My name's Jason Jarrett. I'm an exercise scientist and an exercise physiologist. Every injury is unique and every fitness goal is unique. Work with me and you'll get the professional direction you need with your situation. Welcome back. Today we're talking about graded exposure to movement therapy and exercise therapy and how that interacts with chronic pain. So people might often wonder, why do we do these really gentle exercises on the floor? Things like Clinical Pilates, where it's more stretching, mobility and moving around. For the right people who have chronic pain, or where the body is sending signals to that part of the body to cause muscle contractions or to cause pain during really simple movements, Clinical Pilates is, I think, appropriate because it allows you to go through a certain range of movement that you might not go through on a daily basis and let your body get used to how it feels without putting too much pressure or too much load through the movement. So for example, it's pretty difficult for us to get you doing a strength type exercise for the legs or the upper body, the sort of exercise that you might do in the gym that has tons of benefits, but it's pretty difficult for us to get you to do that if you've got a chronic lower back injury with chronic back pain, and even the thought of bending forward might give you pain. And this is a thing, guys, so when people have had chronic pain for long enough and the pain pathways have become reinforced, we know this through research, that just thinking about a movement that has caused pain in the past or that you fear will cause pain, just thinking about it can actually cause you to feel real pain, can actually cause you to feel it. So you can become that sensitized to pain. So it's really important that when you are at that level, or even if you're not at that level but you're a bit beyond it, it can still be important that we take you through movements gently, week after week, and we slowly expose you and your body to those types of movements so that you are disassociating the pain from the movement. And that can be a bit of a process. So it can be difficult for us if we've only had an initial consult with you. It can be difficult for us to identify which point you're at and how much we need to disassociate the pain from the movement. So that can be a little bit of a process. But I just really want you to understand why things like Clinical Pilates are, I think, fairly important in the initial stages for people with injuries and chronic pain, because it does help us to weed out as well how functional you are, just by taking you through the movements and seeing if you're even grimacing or not, so we can tell what level you're at. Are you even feeling any pain? And we can proceed quickly beyond that level. Now, Clinical Pilates. So I've got the full qualification in Clinical Pilates. I studied with physiotherapists at an institute for sports medicine. I think Clinical Pilates is great to an extent. It certainly has a place, but it is, for those who don't realize, Clinical Pilates is a little bit like yoga, except we know exactly what movements can help for what conditions. It's very gentle. So it's more flexibility, mobility, this type of thing. So Clinical Pilates, I think, has been overused by many clinics and clinicians currently and in the past. I think it drags out to months and months on end, and I think that's a problem because the way I view Clinical Pilates is that it's like a foundation. So when you build a house, you need a foundation, right? You need a foundation to build on. Well, you've got to start building at some point, and the way I view strength training and cardiovascular training, active mobility training, I see this as the process of building the house. So you've got to build the house, but if you just are doing Pilates forever and nothing else, it's almost like you're down on your hands and knees scrutinizing the foundation forever. You're not actually building anything on the foundation. So I would argue that we shouldn't be spending too much time there. It can be good to revisit the foundation every now and then to make sure it's solid and we remember the principles and everything, but we've got to build the bloody house. Like, you can't just spend all the time over here scrutinizing the cement when you've got a house to build, right? So now I have a theory about why many clinicians remain stuck in the clinical Pilates stage, because quite frankly, as a clinician, you're never going to risk causing a flare-up to your client if you remain in that stage. But then how much benefit are you causing your client beyond placebo? I think it's largely a placebo effect when clinicians remain in that initial stage for months and months. And I think these types of placebo treatments that clinicians use tend to cluster together. So I'd say, I'm getting a bit off track, but I'd say people who use clinical Pilates for too long probably tend to use other placebo treatments as well. Look, I'm a fan of giving my clients things that work. So I want to see outcomes. And unfortunately, that's really the road less traveled, and it entails a little bit more risk. And clinical Pilates is really your foundation, and on top of that, we build strength, we build cardiovascular capacity, we build mobility, and that's important. Otherwise, we're not getting beyond the foundation. You can't live on the foundation. The foundation is just foundation. Okay? Got it? Good. Okay, comment. Let me know if you disagree. Comment below, subscribe, like the video. Feel free to reach out to me, and please stay tuned for more amazing videos.